Before starting the presentation, we would like to thank the scientific committee for the opportunity to present our work and congratulate the entire organization for the effort and dedication with which they have endeavored to make possible in a pandemic time the international webinar on aging and rejuvenation. The work developed by us is subject to the theme evaluation of physical and functional fitness of older people with practice of differentiated physical activity. The strong evidence of the benefits of physical activity and physical exercise for improving the health, quality of life, and well-being of the elderly has led several international organizations to recommend them as a known pharmacological intervention strategy for the primary prevention of many chronic diseases, as well as delaying progression and reducing the symptoms of these conditions. Sedentary lifestyle has serious health consequences. Less levels of active are at higher risk for a variety of chronic diseases and mortality. Physical inactivity is identified as the fourth risk factor for global mortality. It seems to be more prevalent among women, older adults, lower socioeconomic groups, and people with disabilities. Advanced age, even if not associated with development of a serious chronic disease, is accompanied by a multiplicity of biological modifications that may contribute to reducing skeletal muscle mass, strength, and function, leading to an overall decline in physiological resilience, capacity to withstand and recover from stressors. It is also related to reduced muscle size, muscle atrophy, motor unit loss, and a decrease in contraction speed, which in turn lead to lower muscle strength, power, and resistance. As a multifaceted and complex phenomenon, aging manifests itself differently among individuals during their lifetime and is conditional on interactions between genetic, environmental, behavioral, and demographic characteristics. Since most of the risk factors associated with an increase in chronic diseases with advanced age, regular physical activity is essential to attenuate the functional declines associated with aging and improve physical and psychological health-related outcomes among older adults. As such, and considering that much of the senior population is sedentary with low levels of physical fitness, the purpose of this study was to verify the effect of the practice of physical exercise on physical fitness and quality of life in individuals of both genders with the practice of different physical activities, and to evaluate the influence of differentiated physical activity on muscle strength, endurance, aerobic endurance, flexibility, and motor ability, power, speed, agility, and balance. The study that we have made is a cross-sectional, exploratory, quantitative, and descriptive research. The sample consisted of 60 elderlies of both genders, divided into three study groups, submitted to a single evaluation moment. Experimental group 1, physical activity, with an average of age of 69.3, more or less 8 years old, practice regular physical activity exclusively at a retired and pensionary association for at least 1 year, with a frequency of 3 times per week, with about 60 minutes each exercise session. The volume and intensity of physical exercise were prescribed within the standards obtained in medical evaluations. As an activity, they performed global exercises for upper and lower limbs with 3 sets of 20 repetitions, stretching and joint flexibility with 2 sets of 30 seconds. The experimental group 2, recreational activity, with an average age of 68.8, more or less 5.5 years, they practice recreational activities exclusively in retirement association for at least 1 year, with a frequency of 3 times per week, about 60 minutes each recreational session. The activities involved card games, pool games, dances, and art workshops separately, or associated activities exclusively at retired association and not engaging in any physical activity program. The control group, group 3, sedentary, with an average of 70.1, more or less 5.77 years old, non practicing any type of exercise or physical activity. We performed and measured several parameters such as anamnesis, body mass index, cognitive state, mini mental state examination, and functional fitness of older adults, senior fitness test, in a single evaluation moment. To participate in the study, the subjects should be volunteers, aged 60 or over, involved for more than 6 months in a retired and pensioner association in the city of Araxá, Minas Gerais, Brazil, without participation in any regular physical exercise program for at least 12 months, and performed basic daily life activities in an autonomous and independent way. They should be capable to understand the activities and procedures proposed during the research. Subjects who presented non-compensated diseases, a result of less than 25 points in the mini mental state examination, MMSE, inability to climb stairs, do not walk 400 meters, medical limitations that prevented the application of physical and functional tests, were excluded from the sample. Concerning to our data analysis, was performed using the statistical software, statistical package for social sciences, version 18 SPSS, and data were treated taking into consideration two aspects: descriptive analysis and inferential analysis. In descriptive analysis, We use parameters of central tendency, mean, and dispersion, standard deviation. The analysis of adherence to normality was verified using the Shapiro-Wilk test, and homoscedasticity was tested using the Levin test. In the differential analysis, and for the comparison of means, when the distribution of the variables of the three groups is normal, we use the one-way ANOVA for repeated measures with the decade post hoc. When the assumption of normality was not met, we used the Kruskal-Wallis test. The level of significance in all tests was set or maintained at 5%. The results obtained by applying the mini-mental state examination, MMSE, in the different groups showed that all individuals had good levels, which ensures that the volunteers' cognitive ability to understand and perform the proposed tests. The results found in this work show a more homogeneous sample since the means reached by the group as well as their respective standard deviations did not present statistically significant differences. The direct effects of physical activity, especially aerobic training on neural physiology of cognitive control, are not yet known and there is no consensus. However, it is observed that regular physical activity of low to moderate intensity throughout life can have a protective effect on cognition. The level of physical activity seems to be correlated with the attenuation of the cognitive decline and with better quality of life in the elderly. The preservation of cognition is very important in the autonomy and independence of the elderly, exemplified in the activities such as capacity for self-care and walking, among other fundamental variables to have a minimum quality of life. The anthropometric characterization of the groups is summarized in the table. From an anthropometric point of view, the sample is relatively homogeneous. In an intergroup analysis, the highest body mass index are related to experimental group 2. There was no statistical difference comparing body mass index between the control group and the others. However, when comparing EG1 with EG2, there was a statistical difference. This can probably be a consequence of the body weight values in EG2 being higher. Regarding the variables age, body weight, height, and body mass index, there were no significant differences. The mean values of EG2 were higher in the parameters of weight, height, and body mass index in relation to EG1 and also to the control group. This fact demonstrates that a sedentary lifestyle and more specifically physical inactivity contributes to body weight gain and its associated comorbidities. The average values for the share stand test show better performances in the EG1 and EG2 when compared with control group. The statistical analysis shows very significant and extremely significant differences when we comparing the control group with the other experimental groups. However, there is no significant variation when comparing the experimental group 1 and experimental group 2. The decrease in muscle strength in the elderly occurs more quickly in the lower limbs, and this fact is justified by the lower use of muscle over the years. The elderly decrease physical activity, remaining most of the time seated with low locomotion. Regular physical activity, especially resistance training, has been cited as an important factor of cooperation in the preservation and improvement of muscle strength in the elderly. For the upper limb strength, endurance, arm curl, the EG1 group had better indexes in relation to the EG2 and control group. However, the statistical expression is only relevant when we compare the data from the experimental group 1 with the control group. For the arm curl, the results suggest that who practice regular physical activity have a better score, even thought the results point to a better performance in experimental group 1. The differences were small compared to EG2 and not as significant compared to control group. A small muscle activation is probably enough to reduce the muscle fragility typical of the elderly, since in this study, the experimental group 2 that practiced recreation activity also found better results than control group. For the parameter of aerobic endurance, 2-minute step test, the experimental group 1 presented better average values compared to the experimental group 2 and to the control group. However, there was no statistically significant difference. It is observed that there were no significant gains regarding the alternate aerobic endurance tests, probably because to obtain aerobic resistance or endurance, it is necessary to have an increase in exertion, changing the cardiovascular parameters. For training to obtain aerobic resistance, it is essential that there is a constant search for increased effort in steady state, because any exercise that is performed outside this physiological balance will have different results from the objectives. In the case of this study, the groups that practice physical activity and the group that practice recreational activity obeyed the principle of specificity. That is, as specific exercises to improve aerobic endurance were not part of the activity. They did not obtain better results than the group considered sedentary. The lower body flexibility, share sit and reach, shows better results in the experimental group 1 compared to the other groups. On the other hand, the EG2 obtained lower results showed than the control group. When the groups were compared, we obtained a significant difference when comparing the data from experimental group 1 with control group and extremely significant difference with EG2. One possible explanation For this, maybe the way in which the elderly in the experimental group 2 carry out their activities, such as, for example, long periods in a sitting position or postures that favor tissue shortening and adaptation, especially in the posterior muscular chain. In the back scratch test, to assess upper body shoulder flexibility, the experimental group 1 showed better results compared to the other group. Statistical comparison is extremely relevant when comparing the EG1 with the other two groups. In the 8-foot up and go test, used to assess agility, dynamic balance, the results show better performances in experimental group 1 and experimental group 2 in relation to the control group. The statistical analysis shows a better significant difference only when comparing the performance of experimental group 1 in relation to the control group, and when comparing the experimental group 2 with control group. We can also observe a significant difference. The rates of agility and dynamic balance for experimental group 1 may have been better, may reside in the fact that elderly people who practice regular physical activity have more functional levels of dynamic power, speed, agility, and balance. Going to the conclusions. The results show that regular physical activity, despite obtaining higher scores in most of assessed domains, did not show any significant difference when compared to the group that participated in recreational activity. However, both compared to the control group obtained better scores and values with significant statistical differences. Strength train, alone or combined with aerobic train, is a fundamental part of the primary prevention of many chronic diseases in older adults. In addition to delaying the progression and reducing the symptoms of related chronic conditions. Most of the benefits occur with at least 150 minutes of moderate physical exercise a week or per week. Vigorous aerobic and strength exercises are recommended at least 2 days per week. Multi-component exercise programs, especially strength exercises that include muscle power training, are the most effective interventions for buffering the impact of physical disability and other adverse health-related outcomes, even in the oldest old. These programs are also valuable interventions in other frailty domains, such as falls and cognitive decline. Physical exercise and strength training should be adapted to the characteristics and contraindications of each individual and prescribed with a progressive individualized plan in order to produce continued benefits like any other medical treatment. Strength training should also be tailored to match functional needs and preferences based on a pragmatic strategy that makes exercise both sustainable and safe. Such a strategy incorporates motivational elements and knowledge monitoring of achievable benefits using an ideographic approach. Thank you very much for your attention.